Good afternoon, everybody. It's March 11th. I'm Gary Pace, the Lake County Public Health Officer, and I'm here to give you the COVID response update for Lake County this week. We are continuing to see an improvement in the case rates. Things are getting better all the time. The vaccine is continuing to roll out. We are putting out between 2,000 and 3,000 vaccines a week now, first and second doses. And it's very possible we're going to be getting to the red tier within the next week or so. So I'll talk about each of these things, but I just wanted to give a quick overview. Now we'll go ahead and go to the epidemiology slide. Okay, so this is a quick review of where things are in the state of California. On the left side, the number of tests are going down, but it's still quite high. And the test positivity rate now is very low. It's down to 2.3%, which is better than it's been really any time during the whole pandemic in California. So that bodes well for the coming weeks. This is the total cases in California. You can see that the total number of cases is now dropping down back to where we were before Thanksgiving. And so that's very reassuring as well. The death rate is dropping, but it's still quite high at this point. This is a reflection of some of the people that got infected a couple months ago. This is a hospitalization in California on the left side, continuing to drop. This is the ICU rate on the right side, also dropping. So this is Lake County now. This is very helpful to see how well we're doing now. You can see about 2 months ago, we had this huge surge, and now we're getting back down to the rates we were seeing back in October or during the summer. We're just starting to get down there. Our total number of cases now is 3,200 with 39 active cases, which is pretty darn good. We do have had now 42 deaths. One new person passed away in the last week. This is the tier situation around the state. You can see that we're starting to get more of the red counties in the state, and Lake County continues to be in the purple tier now, but we'll talk about this in a minute because I think we're going to be moving to the red tier hopefully within the next week. The daily case rate now is 9.2 per 100,000. The testing positivity rate is 6.3%. This is important to understand what's happening with the moving into the new tiers. The state is making some changes, and one of the things they've done is they've divided up the state in 4 quarters. So this reflects socioeconomic status and just general vulnerability to stressors and to the COVID virus. The one on the far left is the first quartile, the one with the lowest socioeconomic status. The one on the right is the highest quartile with the highest socioeconomic status. And what the purple lines are is how many doses of vaccine have been gotten in each quarter here. So the lowest socioeconomic status has had only 18% of all the vaccine. The highest socioeconomic status has had almost a third. So what the state has decided they want to do is start focusing on this lowest quartile with the socioeconomic status so that they can, because these are the people that have the worst consequences from getting the virus. Many of them are the ones that are out working in the out in public right now. And so the idea is to really try to get more vaccine to these folks. So once we get to 2 million doses of vaccine administered in this lowest quartile, we will be able to loosen up some of the restrictions and make it easier to move from the purple tier to the red tier. At this point yesterday, we had 1,930,000 people had been vaccinated in this first quartile. Once we cross 2 million, that's when the new restriction measures go into effect. And we'll talk about that again a little bit more, but it's probably going to happen either tomorrow or Saturday. And this is the last slide. Basically, it's showing that almost 11,000 people have received 1 dose in the county. This is 21% of the adult population. and about 5,300 folks have received both doses, which is about 10% of the population. So at this point now, 10% of the adult population has had both doses of the vaccine, and we're moving along quickly. So let's see. Let's talk about the vaccine. So like I said, we're getting between 2,000 and 3,000 doses a week. It looks like the state's thinking we'll continue to get that kind of inventory for the next couple of weeks. Then probably sometime in mid-April, we're going to see a lot more coming in, probably double or triple that amount. We're working with our local partners, and the state is very involved in this process now, and we're trying to get the infrastructure in place to be able to get that amount of vaccine out to everybody. The appointment situation for the coming week is going to be the same. Starting next Friday, we're going to transition to what we call the My Turn platform, which is going to be a new appointment setup. So, but for the next 7 days through next Thursday, we'll continue to use the same setup that we've been using. So what you need to do is go on to the health department website and click on one of the, get the link there for getting the vaccine appointments, and go ahead and make an appointment when they're available. We only are opening these up a couple days at a time. So because we're making sure that which vaccine we're getting, how much we're getting, and then we open it up. So next Monday and Tuesday is opening up very shortly, and Thursday and Friday next week will be open in a couple days once we make sure we're getting shipments and things like that. Starting next Friday and going forward after that, for the first doses, it'll be a whole different setup, and we'll go into that next week. But I just wanted to reassure everybody that what we've been doing so far is the way to go forward for the next week. Now, the second doses is still going well, and we are continuing to, you can see about half the people have gotten their second doses already, which is great. We have enough vaccine so we can keep providing the second doses. Nobody needs to be worried about that at this point. And there was a backup over the last couple of weeks, and I think that was because some of our partners in the community were having trouble getting their doses. We've been able to share some with them, and I think we're getting caught up now. So if there's any concerns, if people feel like they need a second dose and they haven't been able to get it, contact us and let us know. If you get the Moderna vaccine, 4 weeks after that is when you're due for your second dose. You can go all the way to 6 weeks after your first dose, and there's absolutely no problem. After that, it's there's some question, but it looks like it's fine. So there's no reason to worry if you're a week late or something for your second dose. We did get Johnson & Johnson vaccine, and we've been administering that today. That's the 1-dose vaccine. It looks like we're only going to get this one shipment now, and it's going to be a couple weeks before we get any more. So what went out today is pretty much what went out. We have a few extra doses that we're saving to use for certain populations that it may be important to use them. But for the most part, all the Johnson & Johnson vaccine we got has gone out, and that went out today. So the priorities for the vaccine is continuing to change, and but this is all good news. More people are getting into the line now. Everybody that was getting it before is still able to get it. And then during the last week, janitors, utility workers, and other disaster service workers that work during emergency situations have been added to the list. So if you fall in any of those categories, you're free to go ahead and sign up on the links just the same way everybody else does. Starting Monday, March 15th, people age 16 to 64 that have chronic medical conditions that put them at higher risk are now eligible. There's a list that the state has put out. It's on the state website, and you can look at that. But what you need to do is get your medical provider to write you a note that says you're eligible. It just needs to have your name and your birth date, and that you are eligible in your medical provider's opinion. And then you can bring that with you to the test site. You make an appointment first. You got to have an appointment, and then come on in and show us that at the test site. If for some reason you can't get your medical provider's a note, you're able to write to us at the Mohawk email site, and I'll take a look at them. You need to tell me about your medical condition at that point so that I can determine whether you meet the qualifications or not. And we'll be trying to determine who's eligible and who's not at the site, just like we do with employment and other things. this is going to be a good thing. This is going to be a way to get people that are vulnerable to getting COVID, get them vaccinated now next. So we're excited that this is happening. There's been some questions about out of county people getting in the line here, and we did have some problems with that at one point. Our staff has been really good at the front gate of turning people away that don't have an in-county address. There was questions at the Board of Supervisors meetings about how big a problem has this been, and we looked at the numbers, and it looks like not that many people are getting in. It looks like actually more Lake County residents are getting vaccine in other counties than out of county folks are coming in and getting them in our county. So I think our staff's been doing a good job at turning people away that we, just so that we can save the limited amount that we have for the folks that are in the county. So the test sites are going well. We've been doing this drive-in situation. The other day got really cold and wet, but otherwise it seems to have been going pretty well. It looks like we're going to be changing in the near future to 3 days in Clear Lake and 1 day in Lakeport. Next week, it's going to be the same schedule, but because of increased demand in Clear Lake, I think we're going to try to shift over to having 3 days over there and just 1 day in Lakeport. But I'll let you know more about that next week, but I just wanted to give people a heads up about that's coming. So the blueprint is the thing that the state has about what is able to be open and what is able to be closed. That we have been in the purple tier now for about 3 months, and that's been much less activity has been able to happen in the purple tier because of this change coming up, where the state is going to shift from make it easier to move from the purple tier to the red tier as more people get vaccinated. Where it looks like we're going to be able to probably move into the red tier this coming Wednesday. There's a few steps that have to happen, and so it's not 100%, but the state has to cross over this 2 million number of doses in the quartile number 1, and it looks like that's going to happen either Friday or Saturday. Once that happens, then they will say, okay, everybody that's data is in the 7 per 100,000 to 10 per 100,000 case rate will now be eligible to be in the red tier, but you have to be in it for 2 weeks. We already have 1 week last week, and then it looks to me like this week will be the second week where we're between 7 and 10 cases. So if the state goes in and then they set it the way they have explained that they were going to do, they'll make the determination on Tuesday for the counties that can move into the red tier. And I expect we're going to be in that. So then starting Wednesday next week, the 17th, I strongly suspect that we're going to be moving into the red tier. So what that means is that this will allow indoor dining to 25% capacity. It will mean that theaters can open up to 25% capacity. Gyms and dance studios and yoga studios can open up at 10% capacity. Stores that were considered non-essential and that have been able to open at 25% will now be able to expand to 50%. And a big one is that the middle and high schools can open up at that point. My understanding is that their plans at now are that once this decision is made that we can move into the red tier, which I'm expecting is going to happen next Tuesday, then the middle and high schools in the county have decided that their plans are generally to the following Monday that they would go ahead and start what they're calling hybrid learning. So that's sort of a staggered schedule where the kids would be in a couple days and on site and then a couple days at home, and then other kids would be on the other days on site, so that this keeps the number of people in the schools down so that they can keep the social distancing and decrease the risk. So my understanding is that that will be happening fairly shortly after the state decides we're in the red tier. So this is all really good news. I think just in conclusion, the things are moving along. We're getting now, 20% of the adult population, a little more, has been vaccinated, at least the first dose. And in the older groups, like the 75-year-olds and above, it's over 50% of all those people have been vaccinated. In the 65 to 74-year-old age group, something like over 40% of those people have been vaccinated. So we're moving along in a good way, and the vulnerable people seem to be getting getting the vaccine. So I feel like the rollout here has been successful given the limitations of the amount of vaccine we have. Um, the the variants seem to be much less worrisome than we were concerned about originally. The what we're finding now is that it doesn't seem to be impacting things too much in the state. Hopefully this continues. We're not sure, but I feel a little more reassurance about this now, and that probably things are going to go okay. It doesn't mean you shouldn't still wear masks and you shouldn't still do social distancing, but it does seem to be better. I think the other thing that's really important is that people that are vaccinated, they're not getting sick, they're not dying, and it looks like the risk and the concern about the spread to other people is much, much lower. So what we're seeing so far, and there seems to be more and more evidence now that people that are vaccinated are probably pretty darn safe. And this may change with the variants and things like that, but I think overall we can be very reassured. And I want to really encourage people that have chosen not to get vaccinated or want to wait, that it's a good time to get going, because I think what's going to start happening here in the next couple of months is we're going to see the people that are vaccinated are going to be able to move more freely, to be involved in more activities and things like that. And the people that aren't vaccinated are going to be taking much more risk if they do the same kind of activity that the vaccinated people do. So I really want to encourage people that have been holding back and waiting to see. We're not seeing bad problems with the vaccine, and we're seeing really, really good results. I think another really encouraging thing is that the state is now starting to work on the guidance for outdoor gatherings with families, and also with public gatherings like concerts and festivals and things like that. And it looks like they're going to come out with some guidance by April 1st, helping people to know how to do these things more safely, but allowing them to occur a lot more. So I think this spring and summer we're going to see a lot more flexibility. I don't think we're going to be completely back to normal, and I think it's still going to be a concern, especially for people that are not vaccinated. But I think moving forward, it's all looking very optimistic right now, and that I think we're going to be really happy to see how things are unfolding over the summer. So that's it for today. Thank you very much.